Hi everyone, we are from PulseCare campaign and today we are going to be interviewing a nurse from Kensington Gardens Health Center. So my name is Karavi.
And my name's Chris.
And I'm Emine.
So the first question we have for Nurse Emine is, can you explain the difference between essential hypertension and secondary hypertension?
Sure. So first, let me say what is hypertension first, right?
Yeah.
So the hypertension is the force of the blood pushing against the artery wall, uh, which is consistently too high, and it causes hypertension, right?
Mm-hmm.
So we have two. Uh, we have systolic and diastolic, right?
Mm-hmm.
So uh, this has to be under 140 for systolic, the under 90 for diastolic.
Mm-hmm.
If it goes 140 and 90 are the borderline, right?
Mm-hmm.
So what is systolic blood pressure? It's how much how much pressure your blood is exerting against the arterial wall when the heart contracts. Diastolic is the same thing, but it's when the heart muscle is resting.
Yeah.
Okay, between the contractions.
Mm-hmm.
Now, the hypertension, essential hypertension, is when we have no cause for it,
Mm-hmm.
and this condition is reversible. Right? For example, if somebody is obese or has not a good diet with salt, has a lot of salt, for example, in the diet or something, if this person will have a, take care of himself or herself, will have a good diet without salt or less salt, this hypertension will go back to normal, right?
Mm-hmm.
It's reversible. The other one, the secondary, it's always a cause, is an underlying cause for this, right? For example, first, if somebody has hypertension, first we check is the kidneys. Is the first cause for the secondary. There's some other underlying condition: kidneys, arteries, heart, endocrine system, or during pregnancy, or obstructive sleep apnea, right?
Mm-hmm.
Yeah.
Okay. So the next question we have is
Mm-hmm.
how does hypertension impact cardiovascular health? And what are some potential complications that someone might have?
So hypertension can narrow or damage the blood vessels, right? The arteries that supply blood to heart, which is called cardiac artery disease.
Mm-hmm.
So when the blood vessels will get narrow, will have less blood in the heart, right? And this will lead to chest pain, which is called angina, and can lead to arrhythmia, right? Uh, so the complication, if we have complication, the blood pressure will be without treatment, will lead to complications like can lead to disability, poor quality of life, deadly heart attack or stroke, kidney disease, heart failure, clogged arteries, dementia, brain aneurysm. So this is called, the high blood pressure is called the silent killer, right?
Mm-hmm.
Yeah.
Yeah.
Yeah, it can cause eye damage to blindness of the eye, can cause damage in the kidneys, right?
Mm-hmm. Yeah.
Yeah.
Our third question is, can you explain the importance of regular blood pressure monitoring for individuals with hypertension?
Sure, let me just. So, checking and tracking the blood pressure uh, means that the earlier we catch it, the better it is, right?
Mm-hmm. Yeah.
before we have damages.
Mm-hmm.
So if you have a blood pressure, like if it's a borderline, always we'll have to start with a diet, right?
Mm-hmm.
Less salt, physical activities.
Mm-hmm.
If the person is obese, for example, to do something about it, right? To lose
Yeah.
weight, and the blood pressure will go back to normal usually. But if we leave them, the high blood pressure, if we leave it for a long time, we'll have damage of the blood vessels and we'll have damage of the organs, kidneys and eyes and everything. That's why it's important to track the blood pressure.
Mm-hmm.
The better we catch, the earlier we catch, the better it is. Yeah.
Yeah.
Okay. So what are some like genetic factors that might influence like developing hypertension?
So the most studied genetic association genes involved in in essential hypertension, it's the renin, angiotensin, aldosterone. Have you ever heard of it?
No.
No.
Yeah,
What's that?
yeah. Okay, this is in the. It's produced in a kidney. Like
Mm-hmm.
they produce hormones that
Mm.
will regulate the blood pressure and the balance of the fluids and salt in the body.
Mm-hmm.
Okay. Yeah.
Our fifth question is, how does age affect the risk of developing hypertension, and are there different treatment approaches
So
for different age groups?
yeah. So age affect hypertension common in adults. We see the vascular system all change, right?
Mm-hmm.
Older we get, the narrower the blood vessels are,
Yeah.
right? So and the older we get, with less activities we do, diet is not as good as when we're young, right?
Mm-hmm.
So and all this the age will affect the blood pressure. Um, so the best medication for the over 60, it will be calcium channel blockers,
Mm-hmm.
which will this will prevent calcium from entering in the blood vessels,
Mm-hmm.
right? So the blood vessels will be more will dilate, right?
Mm-hmm.
So the
Yeah.
blood pressure will come down when it will dilate the blood vessels. So this is the best for people that are over 60, let's say. And the medication that is calcium channel blocker is called amlodipine or Norvasc.
Mm-hmm.
Okay. So we also have some questions that we gathered from the community. So we did like a survey. So
Mm-hmm.
whenever people wanted to ask questions, there was a form that they could submit. So we have a few questions from there. So the first question from there is, so how does obesity contribute to like developing hypertension?
Okay, obesity. Obesity can contribute to high blood pressure and to diabetes at the same time. They
Mm-hmm.
go kind of together, right? So
Yeah.
obesity creates a state of insulin resistance because the fat, the
Mm-hmm.
insulin cannot because of the fat, insulin cannot lower the blood pressure, right?
Mm-hmm.
So and this will cause a systemic inflammation in the endothelial dysfunction, and hypertension will have hyperinsulinemia, which will have the vasoconstriction because of the hyperinsulinemia, right?
Mm-hmm.
I think this has to do with the sympathetic nervous system. I don't know if you have done this. And catecholamines that are produced from this system, which will make the blood vessels more narrow
Oh, mm-hmm.
and will
Mm-hmm.
increase the blood pressure, right?
Mm-hmm.
So in this case, and the same in the same time, we'll have this system will they'll stimulate this renin, angiotensin, aldosterone that is in the kidneys, and will produce more hormones that
Mm-hmm.
will increase the blood pressure more,
Oh.
right?
Yeah.
Yeah. So in this case, the best thing to do is to weight loss.
Mm.
Uh, yeah.
And right,
Mm-hmm.
yeah.
Our next question is, how does hypertension affect pregnancy?
So pregnant women, uh, if they have high blood pressure, sometimes
Mm-hmm.
it's a lot of complication. If they have high blood pressure, it's called, if they have, it's high preeclampsia, eclampsia. Sometimes they can go to stroke, and there is a need for labor induction, right?
Mm-hmm.
So blood pressure has to be lower than 160 and the diastolic lower than 110. Uh, the blood pressure usually it will start if we have preeclampsia. It will increase in week 20 of the pregnancy, and it will get to normal after the baby is born. It will
Mm-hmm.
get normalized. The same thing with diabetes in pregnancies. So pregnant women, they have it's called gestational diabetes, right?
Mm-hmm.
It's only when they're pregnant. Once they deliver the baby, the diabetes will be gone,
Mm-hmm.
right? Yeah.
Okay. Yeah, so the next question is, so what are some potential like complications that people might have if they decide not to treat or
Not to
if
treat.
they don't manage hypertension that well over like the long term?
Yeah. So the high blood pressure, if patient don't treat it, can lead to a lot of complication, to disability, poor quality of life, as I said, heart attack, stroke,
Mm-hmm.
right?
Yeah.
Damage of the kidneys because of the high blood pressure. They can damage the kidneys, which is kind of, kidneys can cause high blood pressure, and high blood pressure damage the kidneys most, right?
Mm-hmm.
Can have heart failure, clogged arteries, dementia, brain aneurysm. We spoke about this, right?
Mm-hmm.
Yeah.
Vision, blindness, damage of the eyes.
Mm-hmm.
Yeah, it's a lot of complications if people don't treat it
Yeah.
well.
Our next question is, how does chronic kidney disease contribute to the development and progression of hypertension?
Okay, yeah, it's the same thing. We said that kidneys and blood pressure,
Mm-hmm.
um, they kind of work at the same time. The kidneys will cause high blood pressure. High blood pressure will damage the kidneys, right?
Mm-hmm.
So diseased kidneys are less able to help regulate the blood pressure. As a result of this, if patient has cardiac chronic kidney disease, high blood pressure makes kidneys get worse, and you'll have also the heart, right? So renal hypertension is high blood pressure caused by the narrowing of arteries that carry blood to the kidneys.
Mm-hmm.
Renal artery stenosis, and will have the kidneys are getting not enough blood. They react by making of this hormone again, the renin that I
Yeah.
spoke before.
Mm-hmm.
They'll make the renin, and the renin will increase the blood pressure.
Mm-hmm.
Okay. So there's one more question. And so that question is if you could explain the correlation between stress and hypertension.
So the impact of stress on the development of hypertension is believed to involve sympathetic nervous system,
Mm-hmm.
Mm-hmm.
right? In which release of catecholamines leads to increase of heart rate,
Oh.
cardiac output, and blood pressure,
Mm-hmm.
right? As a
Mm-hmm.
result, we'll have narrow blood vessels, and we'll have an increased blood sugar.
Mm-hmm.
Uh, so the best thing for this, for the stress, is some exercise for 10 minutes, breathing exercise, and to rest.
Okay.
Right? Yeah. Stress will give, we have the essential hypertension, right? It will increase hypertension, but in 10 minutes, half an hour, if person is relaxed, it will go back to normal. But if it, goes always like this and not treated, it can cause, damage in the organs and stuff. So, yeah.
Hey, thank you so much. We finished all the questions, and I once again want to thank Nurse Amina for joining us and help us explain the answers for some of these questions we had. And I truly would like to thank you for spending this time.
Yeah,
Thank you.
We appreciate it.
Thank you.
Okay, you're welcome.